Hello everyone, welcome to my YouTube channel. Today I'm going to be talking to us something I think hopefully should be able to benefit you when you go for interview. I'm sure that there have been some occasions maybe you have gone for interview and they ask you a question surrounding anticoagulant contamination. And in most cases maybe there can be a gap in knowledge on how that is being presented. I hope I should be able to address that today. I'm going to be talking about anticoagulant, maybe like heparin. But before we continue, my name is Dr. Emmanuel Ogbodo. I'm a biomedical scientist and I'm also a lecturer in biomedical science here in the United Kingdom. So let's first of all talk about heparin. Heparin is an anticoagulant, obviously. So you can get something like low molecular weight heparin or high molecular weight heparin. We also have what we call unfractionated heparin. Whichever way, they are all family of heparin. And I've said that this anticoagulant target mostly intrinsic coagulation pathways. Okay, so what it means is that, like I've said on my previous video, that Aptt measure intrinsic pathway. What it means is that with Aptt we can be able to determine the effect of this very heparin, which target mostly intrinsic pathway. What do I mean? If heparin targets mostly intrinsic pathway, it means that if Aptt measure intrinsic pathway, then with the Aptt result, we can be able to determine the effect of this very heparin in the intrinsic pathway. That is, if the patient is on heparin. Because I'd already mentioned on my previous video that when Aptt is raised, there are a number of factors that could lead to that. One of the factors is when the patient is on anticoagulant, such as what? Heparin. Okay? Now, if that fact has been established, the question now is, what then happened to Aptt if the sample is contaminated with heparin? Remember, we have a sample bottle which contains heparin. So we have heparin anticoagulated bottle, okay? And not just that, there's what we call PICC line. You know the way that maybe someone is on the cannula of someone, that they can attach maybe normal saline on that very cannula to help to flush it, as the case may be. Also, they can also attach on that PICC line. They can also attach heparin, which is an anticoagulant. What it means that can contaminate that very line. Does that make sense? Okay. So what it means then is that if a sample is contaminated by heparin, either through a PICC line, like I've said, or maybe through a sample bottle that contains heparin, if that sample is contaminated, then it can give a false raised Aptt result. So in some cases, when Aptt result is raised, it may not be because of the person is on anticoagulant. It may not even be because of some other factor that I have highlighted on my previous video. It could also be due to sample contamination due to this very heparin, like I've mentioned, PICC line. I hope that makes sense. So once you get a raised Aptt result, remember that one of the factors could also be due to sample contamination by what? Heparin. And this can occur maybe a sample taken from a PICC line, okay, that is being flushed using a heparin, or maybe a sample mistakenly collected in what? Heparin anticoagulant bottles. I hope that makes sense. Let me tell you guys the mechanism of action in which heparin can be able to inhibit the clotting formation. First of all, I want to start by saying that it does it by interacting with a natural anticoagulant called antithrombin 3. So from the word antithrombin 3. So that means that interaction can then help to prevent the conversion of prothrombin to thrombin. Remember, when prothrombin is converted to thrombin, then there can be a conversion then to fibrinogen. So the inhibition of conversion of prothrombin to thrombin would then, stop that very final of thrombin to what? Fibrinogen, and of course that will affect the clot formation. I hope that makes sense. So it interacts with a natural anticoagulant known as antithrombin 3. Now, what it then means that this heparin can then have effect, can interact and affect or inhibit the effect of thrombin, which is factor 2. Now, another thing it does is also it can also inhibit the effect of factor anti-10A. Now, this factor anti-10A is, I think in most cases, is a starting point of the common pathway, remember, okay? So this factor 10A, this heparin would then interfere with it, and that interference would then affect the overall cascade towards the end point, okay, from that common pathway. Because one factor 10A is converted to prothrombin, then to thrombin, then to fibrinogen, and so on. So once anti-10A has been affected or inhibited or blocked, or the action or the function has been affected by this very heparin, that effect on the anti-10A will then affect the rest of the cascade, whether it is from prothrombin to thrombin and all the rest. I hope that makes sense. So heparin carry out its function by interacting with antithrombin 3, which is a natural anticoagulant, and also it can also interfere with factor anti-10A, and that factor anti-10A is what that enhances the conversion of prothrombin to thrombin. I hope that makes sense. Now, why did I say this? Sometimes when you in coagulation, when we notice that APTT is maybe very high, so once it is very high, if you start suspecting that maybe there is something associated, maybe this result might be associated with heparin, whether it is in form of contamination, heparin contamination, or maybe the patient is on heparin. One of the things you can do is then do what we call factor 10A, anti-factor 10A. So when you look at the anti-factor 10A, is going to be very high. So once you do anti-factor 10A and the result is high, it gives you a confirmation. It strongly suggests that there is something that has to do with heparin in that patient result. It's either that the patient is on anticoagulant known as heparin, or the sample has been contaminated with heparin, like I've mentioned. Okay, so what am I trying to say in summary? Once you notice that APTT is raised, one of the factors I want you to include, among other factors that I've mentioned to you guys, is the fact that it could be due to contamination, due to what? Heparin contamination. So it could be due to anticoagulant contamination, such as what? Heparin. And this heparin contamination can then affect that APTT result being high. And I've explained the mechanism. Another way you can confirm that it is actually heparin, like I've said, is to look at factor anti-10A. That factor anti-10A is going to be high, and that will give you a strong indication that this is actually, that the person is either on heparin, or that the sample has been contaminated by what? Heparin. I hope that makes sense. So in other words, if you see a high APTT and you check the patient record, the person is not on anticoagulant, okay, and you find the patient is not on any anticoagulant including heparin, one of the things you might need to look at, is it contaminated? Okay, the contamination, maybe through a PICC line, like I've said, could actually explain that result, among other things that I've already explained on my previous video. Hopefully that have made sense. So if you go for interview, they ask you a question around high APTT, remember to include the fact that anticoagulant contamination, such as heparin, can also affect the result of the APTT result, even though the person may or may not be on anticoagulant, such as maybe something like a PICC line flushes can contaminate the line, with heparin, and that can affect the overall result. I hope I've been able to make this very simple and clear to you. So let me know what you think about the video. Once again, thank you very much for listening. Can I ask you to subscribe, like, share, and comment? I wish you all the best till I come back your way again. Bye bye.